What if I told you that every 21 hours, a Canadian will get diagnosed with cancer, and that out of every 5 Canadians, 2 will be diagnosed with some form of cancer in their lifetime? Sadly, cancer cells are your body cells that have lost their minds and have gotten this ability to keep growing without control. They're also smart enough to bypass safeguard mechanisms such as apoptosis, commonly known as cell suicide. This is a normal biological process where your cells invest energy in their own demise so as not to become a nuisance. However, current chemotherapy is sometimes unable to distinguish between a cancer cell and a non-cancer cell. So when it induces this apoptosis or cell suicide in cancer cells, it has a similar effect on non-cancer cells. This brings us to my thesis, which is divided into 2 main parts. The first part of my thesis is to find a way to remind cancer cells selectively to undergo this cell suicide program. We have found this using a natural health product that most of you would be familiar with. They're the dandelions. These are those frustrating, annoying weeds on your front lawns that we're always trying to get rid of because we assume that they're useless. In the course of my study, I have found that these weeds might actually be useful in the fight against cancer. We have found that dandelion root extract, a simple water extract, is able to target cancer cells specifically to this cell death program. These exciting findings have been seen in various cancer cell types, in animal models, and in blood cells that are isolated from patient samples. This also led to the second part of my thesis, which is to understand how dandelion root extract works. We have found that there are multiple components within this extract that can target the multiple vulnerabilities between a cancer cell to exploit those differences in order to induce this cell death program selectively. These exciting findings have led us to apply for and be approved by Health Canada for phase 1 clinical trials, where we hope to move one step closer to eradicating this disease and possibly improving the quality of life of cancer patients in Canada. Thank you for your attention.